All right, good morning and welcome. I'm Dean Miller, the President and CEO of PACT, and I want to welcome you to our Digital Health Series, the first in a series of programs, this one specifically focused on the patient journey. You're going to hear from some experts in the field from a variety of different types of companies, and excited to present this program this morning, and can only do it because of the grateful support of so many terrific sponsors. Anexinet, Duane Morris, Eisner Amper, SAP, and Independence Blue Cross. Thank you to all of them. This morning, we are in a webinar, and we just ask that you please stay muted. You can use the chat box to ask questions, and we'll monitor that throughout. So feel free to start asking questions from moment one. We'll collect those. We'll make sure that our panelists respond to them. We'll go to 9:30. And then in the chat, we will drop the link to the Remo virtual networking room, where we can hop over and spend 30 minutes from 9:30 to 10 networking. If you haven't done it before, it's a terrific opportunity for face-to-face networking. Our panelists will be there, obviously other attendees as well, and you're able to hop literally from table to table and have conversations about topics, etc. Without further ado, let me introduce our moderator. Welcome to Tom Olenzak, longtime PACT member and supporter. Tom served as the Managing Director of Corporate Development and Strategic Investments at Independence Blue Cross, and is going to take the program away. Welcome, Tom.
Thank you, Dean. It's great to be here, even virtually on this beautiful Tuesday morning here in Philadelphia.
You're showing us just how beautiful the morning is from your background there, Tom.
Yeah, no, it's lovely blue skies here in the city. So anyway, so like as Dean said, I'm Tom Olenzak, Managing Director at Independence Blue Cross. I've been with Independence for about 8 years in a number of different roles, including leading our innovation effort and now leading our corporate venture capital fund. Before that, spent some time as an investor with Safeguard Scientifics here in the region. And then have spent a number of years in a series of roles as a digital health investor, a digital health entrepreneur, actually jumping in and leading some of these companies. And like I said, now at Independence as a digital health investor. We have a great panel here. I think I'm going to start off and ask, there was 5 members, ask everybody to take just a minute or two to introduce themselves, kind of where they currently sit, just to give us some background on the perspective that you're bringing to this discussion on the digital health. And I think we'll start on the left and go down and then go down the right column. So we'll start off with Adam.
Hi, everyone. Adam Groff. So I'm helping BAYADA Home Healthcare set up a new venture fund and venture studio to support entrepreneurs who are building companies focused on serving patients at home. So I'm a physician. I still practice part-time as a hospitalist in New Hampshire, actually, and I've started several other healthcare companies. BAYADA is one of the largest nonprofit home health organizations in the United States in over 20 states, over 30,000 employees, caring for tens of thousands of patients a year. Excited to be here. Really, I'm focused on supporting entrepreneurs who want to build mission-driven, tech-enabled services businesses.
Thanks, Adam. Glena?
Hi, I'm Glena Crooks. I'm accustomed to being in the audience at PACT sessions, so it's my pleasure to be on the panel this time. I'm the co-founder of the Cogent Stage Group, which is a data and digital health company. In that context, I have used well over a decade of research to expand on our perspective of the patient journey, to focus not just on the journey within healthcare, but how that impacts the rest of the patient and the caregiver's life. Now, I've come out of a kind of a retirement as a vaccine and pandemic expert in the last couple of years. So things I say today might draw on that perspective during the time that I was a global vice president of Merck's vaccine business, and even before that, when I was the nation's chief health policy advisor for 5 years. Again, it's a pleasure to be here.
Thank you. Vijay.
Hi, good morning. Vijay Verma. I'm AVP and ACIO at CHOP, and my team represents emerging technologies and transformation. I have about like 15 odd years of experience working at different healthcare entities, EMR companies, digital health startups. This is my first time working for a healthcare system, and the perspective that I bring is as a technologist, as a product, but also supporting an enterprise cause of transforming the patient journey through this complex scenario.
Awesome, thank you. And then we have our two CEOs, Dan.
Great to meet everybody. Dan Goldsmith, CEO of Tendo. I'll be brief. Tendo, we started up within the last year. At Tendo, we're looking to become the trusted connection between patients, clinicians, and caregivers through software that can provide a more seamless, consumer-driven experience throughout the care journey. So a real focus there. Over the last 25 years, my focus has been on leading and building some of the best vertical SaaS companies in the market. Viva Systems, where I spent a decade building the company, has become the entire backbone for life sciences. After that, I was the CEO of Instructure, makers of Canvas in the educational space, and we've turned our attention towards healthcare. So in starting Tendo, we went on a listening tour where we've done now hundreds of interviews, talked to over 60 different healthcare systems and organizations to really understand the challenges and the opportunities in healthcare today, and how we can really re-engage and reinvent the patient experience in healthcare so it feels more like what our consumer experience feels like in other industries. So good to be here with everybody.
Sounds good. And bringing it home, Jill.
Thanks so much, Tom. And similar to Dan's perspective, Kith and Kin, we fundamentally believe that the path to better health results from an engaged, informed, and truly activated support system, and that we need to empower the people who serve at the center of those circles to really change those health outcomes for the better. So we built a personal digital health tool that allows you to author, store, share, and manage important health information so that the right people have the right information at the right time, and also that we make healthcare simpler for the consumers so that they can manage health the way they manage life. My background is, I would say, a little eclectic on paper. I'm actually closet CPA by trade, spent 8 years in public accounting at Arthur Andersen, mostly in the healthcare and nonprofit space, and then went to United Way in Philadelphia. First as the CFO, then the COO, then the CEO from 2008 to 2014 before coming back into the healthcare space, which is where I reconnected with Tom and spent 4 years at Independence Blue Cross leading the business transformation team before the latter part of my career going into the startup space over the last 4+ years. So thanks so much for having me.
Thanks, everybody. So it looks like it should be an interesting panel. We've got a lot of different perspectives here. So let me start, if I may, by setting the stage a little bit. When we talk about the patient journey, we're really talking about the way the patient experiences healthcare. And I think most of us, and we had a pre-call for the panel, I think we would all agree that the patient journey in our current healthcare system is broken. And I think there's sort of wide enough agreement with that statement that I don't think we need to go in and delve into descriptions of what is broken or what is wrong. But what we'd like to do is think a little bit more about what can be done by some of our different organizations, what agents of change have to be activated to really improve the patient that patient journey. And the way I think about it is sort of the way healthcare works today in our country is that there is, we have a tremendous and amazing array of interventions, technological, pharmaceutical, procedural, that we can use to fix things when something goes wrong with a patient. But we don't have a very good way of managing that. But the way those interventions are supplied to the patient, it's very much like the journey of building a house. If you think about building a house, it's got plumbing, it's got electrical, it's got framing, it's got windows, it's got doors, it's got all these different pieces. And our healthcare journey is very much like the experience of building a house where you have a ton of subcontractors who all have awesome sets of tools, but nobody's pulling it all together. You have to go talk to somebody and say, yeah, you want sinks, I'll do sinks in your house. And you talk to somebody else and they say, yeah, I'll do windows, but I don't do doors. and you're left kind of bouncing around amongst all these different contractors trying to pull something together, instead of having a general contractor or somebody who says, yeah, I'll build you a house. At the end of the day, you know, you'll have a place to live. And I think that's kind of where we need to get to in healthcare, is the idea that we look at not just the inputs of what different services that we're able to provide to a patient, which is really what we've done in the past, but be able to look at the whole, you know, at the person and at the outcome, at what we're trying to deliver, which is basically healthy people able to live their lives, you know, either in spite of or without disease. So we're talking about really, it's what we in independence are calling whole person health, the idea of looking at healthcare from the perspective of the patient or the member or the consumer, and looking at how they experience the journey through the healthcare system, rather than what we as a system have historically done, and really looked at the suppliers of healthcare and looked at what their experience is, and built everything around the convenience of those actual suppliers. So as we look forward to this sort of whole person health centered health, you know, experience, I think there's a couple of things that are kind of necessary to make that happen. You know, we've got to start looking proactively at people and look at them as patients, not just as patients, you know, as potential candidates for different, you know, medical procedures. I think we have to look at how we gather and how we share data, you know, instead of asking a patient every time they encounter a new caregiver for their life's history. We need to be able to have that information and get it shared appropriately with the appropriate privacy safeguards, so that the data is available when and where it's needed, and where it can actually impact the care that's being delivered. And I think this future healthcare system needs to really look at how the member or how the patient experiences healthcare, what they're seeing, what they're feeling, how they're reacting to what's happening within, you know, what's happening to them. Today's system, I think, is the patient becomes a passive recipient of a lot of different care, rather than an active participant and the focus of that care. And then I think as we look into kind of even more future states, I think a healthcare system really needs to encompass not just the medical side of healthcare, but really the overall person, or, you know, who's experiencing that care, and really understanding all of the other factors that impact their life as well. These are what we call social determinants of health, but you know, a good example is prescribing somebody heart medication doesn't help drive good outcomes if that person either can't afford to fill that prescription, or can't get to a pharmacy to fill that prescription. So being able to understand what else is going on and being able to treat those factors are the ways that we're going to impact disease. So I'll stop there. But what I'd love to do is do a quick round robin of our panel, maybe starting with Jill, just because I can see her on the screen. Do you agree, you know, very quickly, do you agree with this kind of whole person health vision of, you know, of health? And what is maybe the one major thing that you see that's preventing us from getting there? And like I said, we'll go around the panel, so we'll try to keep this quick.
Yeah. So no, I mean, first off, I love your analogy, because I've always said, you know, the biggest challenge in the space is that people have had to become general contractors of their own body. So it's been, you know, and for me, this is about the fact that we need to make consumer health tools simpler. When we made the shift to consumer health, what we tended to do at the outset was create this infrastructure where what we did was expose existing systems out to consumers, rather than really try to understand. To Dan's point, we also went on listening tours, right, to try to listen to people and understand how do they use, consume, and even comprehend health information. And, you know, after a year of user research, we looked at such a painful web of workarounds that people created to work in a very highly non-human centric system and try to kind of conform it to things they understand, right? So we got people, you know, out there taking photos of everything. from discharge procedures to rashes to incisions. They're making contacts in their phone with their doctor information and making notes on their visits within those contacts and in notes in an Evernote, right? They're, close your ears for people in privacy, they're sharing patient portal logins, and they're downloading documents to Google Drive. They are emailing those documents to themselves and writing notes on them so that they can search and find them later. And then most painfully, our earliest user research participants were a group of women with metastatic breast cancer who were carrying around a 3-ring binder. So look, for me, at the end of the day, they've done all of this because these are tools they know how to use, right? They didn't need to learn 7 different platforms and keep all those things integrated to, look at a photo or read a note on their phone. So, we talk a lot about meeting people where they are, but I think we're still pretty far off from that. And that has to be a change we make.
Thank you. That's awesome. And I do remember there were oncologists that were coaching people to create those 3-ring binders when they came in and said, every piece of paper you get, it goes into the binder. And it's a heinous workaround, but unfortunately is what we had to do. Glena, from your perspective, I'd love to hear what you think about this kind of integrated vision.
Like Jill, I really appreciate your analogy, and I've never heard it before. What strikes me is that when you've talked about building a house, it's actually even more complicated than you described, and so is healthcare. So some of the real, I think, best insights that we have received in the last at least decade, maybe more, have come from people inside healthcare, especially clinicians who then became a patient, who could see both sides of the experience. And I don't think we've done enough to really capitalize on that. I think that we really could do more. Now, I will add from my own research that, and vis-a-vis the complexity, that even we in healthcare don't understand quite how complex it is. One of the things that I've done is to enumerate all of the various types of people who are involved in taking care of a patient in a hospital, acute care hospital. A nurse works with 125 different types of people. Back to Jill's example of the woman with metastatic breast cancer, I've done one study in conjunction with a woman's husband and identified that she was actually cared for by 23 different types of nurses while she was in the hospital. Now, this gentleman happens to be an expert in healthcare. He said, I know who these people are. I could help manage them. What does somebody do when they don't? So I think part of our role is to look more closely at ourselves so that we really understand it, and then to find the ways to bridge our understanding to what the patient experience has been. I'll mention just one other innovator in that regard, and that's somebody in this local area, Betty Long, who 15 or so more years ago created Guardian Nurse Healthcare Advocates to coordinate care and intervene on behalf of patients, because she, as a nurse, could not handle the care of her aunt, who was also a nurse, while her aunt was in the hospital. And she reasoned that if even she couldn't do it, how does the average person do it? And she was right. She's got a vibrant business. So while technology also, and all the things you've mentioned, Tom, will be helpful to us, I also think we need a whole big dose of high touch in everything that we're doing as well.
That's actually, that's a really interesting point, is that, I mean, I know in my role as an investor, I see a lot of companies, I won't say it, but most of them come from the West Coast, who want to impose technology on healthcare. And it just doesn't work, because healthcare has to be high touch. That you can't eliminate. A lot of technology is designed to eliminate the human intervention and automate a process that used to be manual. And you cannot do that anywhere near 100% in healthcare. In fact, Adam, from the home health perspective, I think it'd be interesting to hear your thoughts on this.
Yeah, I mean, I think generally speaking, I agree with you that, thinking about people holistically is really important, right? The whole person. What I would say is that people within the system, clinicians, caregivers, family members, patients, we all, are trying our best, right? People are working really, really hard. Even the payers, right, Tom?
Even the payers, yeah.
Payers. The individuals in the system really are, by and large, doing their best to be helpful, right? They're doing their work. Most are mission driven. And, in some ways, what we're seeing, and I think one of the things that COVID has exposed is, despite best intentions, sometimes our systems, don't let people do what they know that they, want to be able to do and should do. And so, the thinking from the home, is, the home really, at the end of the day, is the center of people's lives, right? Wherever they live, it is the center of their lives. And I think the evolution of healthcare, the more we think about the home also becoming the center of the health system, is a kind of way of thinking, I think, around how we can help people achieve that whole holistic, experience, right? So people, most of the time, they don't want to interact with us, right? Most of the time they're at home, they're doing their thing. They'd much rather, spend time with friends, family, Netflix, whatever, right? They don't want to deal with us. And so, when we, even if they're in like a socioeconomic situation where, those of us on the call might be like, holy cow, how are they surviving, right? We, in the home health space, we're going to their homes all the time. And, they're usually pretty happy, right? And even if they may not have a lifestyle that we agree with necessarily, right, or may lead to bad health outcomes, we have to meet people where they're at, right? And so I think when we think about the home, the challenge is, we have people who are trying really hard to do the right thing. Both in the home care space and then with the physicians or the health systems that we're working with. But we have this kind of institutional legacy, right, from the 20th century, which is building bricks and mortar and making people go to the hospital, go to the doctor, right? And so to me, the 21st century is all about kind of re-architecting and reorganizing how care is delivered. Obviously have a bias that it's, thinking about the home as the center of the health system. But I think if we start thinking about that, like how do we keep people, enjoying their life, right? Keep them as empowered, make it convenient, make it simple for them, focus on that experience at home, right? We're going to have a good lens on what we need to do.
I think that's interesting. In fact, we did a panel at last year's PACT Investor Conference specifically around the home as the hub. And I think that was there's quite a lot of work being done there. Vijay, I'd love to hear your perspectives, especially as somebody who relatively recently has moved into really into the depth of the healthcare system.
Yeah, absolutely. So first of all, I have to lead off with a disclaimer. Most of the views that I represent on this call are mostly mine and are not representative of CHOP as an organization. So just in case I touch on a sensitive topic. That said, I do completely agree with the problem that we're discussing in terms of it needs to be about the patient, it needs to be about outcomes, and it needs to be about, as you said, high touch and high empathetic care, as opposed to a cold-hearted automation, right? That is not what we will resonate with our patients, and that will not resonate with most of the stakeholders that are involved, right? And when the state of the health system, where it is right now, there was nothing malicious that kind of led us to this. There's a reason why employers have a role to play. There's a reason why insurance has such a big role to play. It's just that how healthcare evolved over time, there is somewhat of a misalignment between everybody's interests. And now we are kind of struggling with how do we get all these interests matching up and point back towards a patient as opposed to our own respective institutions. And like as you said, like I'm relatively new to CHOP, and this is the first time working for the healthcare system, and I was very keen on gaining the perspective and tackling the problem from inside. Because at the end of the day, even if you do put patients to their home or to another setup, you still need providers or like nurses to take care of the medical condition. Like there is no element of technology that can fix somebody's broken arm or take care of cancer per se. Like we can automate, we can remove the friction in needing for care, but we cannot automate the actual diagnosis or the actual treatment that needs to happen. But the problem that we have to solve is a better alignment across the interests of all the stakeholders that are involved in ensuring a proper and optimal care.
So it sounds like a common theme here. And by the way, I very much appreciate the comment about caregivers. And I think most people who are in the healthcare system are legitimately in the system to help people. And it's easy to blame kind of the workers, or but I think what we really have is it's much more of a systemic issue, is that we have built up a system that is we've built up a system that really does not incent empowerment of the patient. We built up a system that really incents the empowerment of the service provider. Dan, I'd love to get your thoughts on this. You guys, your company is working on some of this, some of these very issues.
Yeah, so lots of great thoughts from the group here. If I step back a bit on this conundrum and looking at sort of the history of healthcare and the opportunities before us, I actually think we need to reorient our ideas of what healthcare is and what the role of an individual or patient is as well. And that, in my opinion, starts with redefining, the we. What do we mean by we? It's interesting. We all talk about the we here, but the way we talk about we is almost like we're doing healthcare to a patient, not actually collaborating with a patient. And that's where the problem sort of starts, in my opinion, right? Patients are not houses and they're not guests or visitors to healthcare. And so we need to shift towards a much more shift from a paternalistic model to something that is much more collaborative. And I think, Adam, you alluded to this. We come from a 20th century era of systems that is built around the control and administration of healthcare that has actually moved the patient out from the center of focus and has really caused impediments to delivering the best care and wellness possible for each individual in a personalized way. So I think we need to reorient our idea of what we means and putting the patient back at the center. Tom, to one of your points, as a career technologist, I also don't believe technology should be a star player in this equation. I think the best technology is the technology that sort of fades into the background and can superpower humans and support what we do and what we're trying to do as well. But we really need to dispel this idea of control and relinquish some of that control to make room for a more collaborative model working with patients moving forward. And if we're able to take that leap, if we redefine that we, and we create a new scaffolding for healthcare, then I think we'll see the results that all of us would like to see around outcomes for care and wellness.
So we've had a couple of questions from the audience around, what are the major gaps, and we, questions on major technological gaps, but also questions on attitudinal and cultural gaps that need to be addressed to be able to move us, to be able to start to make this cultural shift away from the kind of the health, the provider as the center of the healthcare system, and create a true patient-focused healthcare. I'd love to maybe take a couple of maybe start with actually, Dan, since you're up, maybe get your thought. But what are a couple of one or two of the key things that we would need to address, the key gaps that we have to fill before we can move in this direction?
From a technology perspective, or generally?
Well, I think we got questions on both, and I think, like you just said, both of them are completely intertwined. You can't do one without the other.
Yeah, I think, I think first, we need to think different around a collaborative model that encompasses a new idea around networks and marketplaces, if you will, for the way that we work together on behalf of patients. The core gap in my mind, and from my observations, actually starts with the liberation of data and putting data back in the hands of patients as well, right? The example I always use is I can, at a click of the button, see my entire financial health, but for the life of me, I can't do it for my personal health. And that's a fundamental issue. So I think the first gap that we need to solve for is making sure that data and information, while still being obviously protected and such, we need to create an environment where patients are back at the center of that, owning and having visibility of their full data. And that data interoperability and information is much more fluid in a way that benefits the patients and the clinicians and the caregivers, frankly, that wrap around that patient journey and that patient experience. Until we unlock that equation, it's going to be very, very difficult for the community of clinicians and creators and technologists and others to really rally around something that will provide a much more longitudinal and connected, ubiquitous experience for individuals.
So the data is critical. Who was that who just jumped in?
Sorry, I was just going to say it's Jill.
Jill, go ahead. Yeah.
So I know I was just going to say, just to kind of follow on to Dan's point, I think, and I agree with everything he said, and I would just take that kind of one step further to the cultural question that kind of you had asked in terms of those norms that need to change, is that, it's not just engaging the patient, right, but it is that extension to their support structure, to Adam's earlier point about the home as the hub, right? A lot of our existing technology, infrastructure, data sharing ecosystems create either one-to-one solutions, or perhaps they address kind of a nuclear family unit, right, with 2.4 kids and a dog. But our research showed us that, while what people need tends to be reasonably consistent, who needs it within that ecosystem tends to vary pretty dramatically. From that very nuclear family unit to a group of adult males with an HIV diagnosis who share information only with people in what they refer to as their houses, right? Or I talked about, the women with metastatic breast cancer. Number of them are, circles of single women in their 30s whose support structure is their best friends. And we've got to figure out a way to enable those structures, because for me, at its core, it's really time for us fundamentally as a society to realize that health is in fact a team sport. And if we're going to effectively activate that team, we need to figure out a way to stop treating them like spectators and find a way to actively get them in the game.
I think that extended network effect in healthcare, I think, is critical. And of course, we at Independence have been looking a lot at that. I mean, even to the extent that we look at our enrollment centers where people sign up for health insurance, and you've got a desk and a chair for somebody to take the information and a chair for the person on the other side to give the information, and recognizing that a lot of people don't buy health insurance that way. It's a family event. It's an extended family event. It's a and really rethinking we're doing that, or how we think about that. Glena, I know you've done a lot of you've thought a lot about this sort of network effect in healthcare, and actually, just coincidentally, we've gotten a couple of questions on it as well. So, Glena, I'd love to hear your input on this.
Yes, I'm going to comment and say that I love what Dan said, and Jill as well. Just a data point in case you want it. Only 20% of families in the United States today are the one that Jill described at the start, with a mom and a dad and a couple of kids and a dog. That's 20% of our families. So, and right now in America, single adults outnumber married adults. So we have to think more broadly, to their point. Now, what I would say though, is for any of us in healthcare to be successful on this technology side and what we hope to achieve, we are building on top of systems that our communities either have or have not established. So sitting here in the Philadelphia area, most of us, but not all, have access to broadband. But that is not the case in a lot of the rest of the country. So parts of the country and people in them who could benefit the most from what we could do in telemedicine, for example, are not going to be able to get access to it because they don't have broadband. In my view, part of what we need to do is bring in others in our communities. And by the way, then, Tom, that speaks to some of the networks that I have identified, the social and community network and the employer career networks that we all have as well. Within those locations are civic and government leaders who have the resources or the political heft to make the changes we need locally so that we can build on those for the benefit of the patients that we're caring for.
So this is obviously, I mean, as I think, in fact, I think you mentioned it in your opening comments, is that a lot of these analogies break down because this is such a complex system that it's very difficult to address. You can the way I look at it is, we look at a lot of these technology or a lot of these healthcare companies, and they start pulling at one thread in the blanket, and unfortunately that thread is attached to everything else, and it makes it very difficult to drive some change. Speaking of change, I know Adam and Vijay, you are representing some more established players in the healthcare system. And I'd love to get your thoughts maybe on what you guys are, maybe what your institutions are actually doing. I know, Adam, you're doing a lot with entrepreneurs. I know Vijay, CHOP obviously is doing some really exciting things. But love to maybe have each of you spend a moment and talk about some things that you're actually doing to try to impact this problem in healthcare.
Adam?
Yeah.
You want to go first?
Sure, happy to. I think the biggest opportunity that BAYADA has is we're in the homes of thousands of people every day, right? And when you're in the home, it gives you a certain amount of humility and context to what patients actually care about, right? Gives you a sense into their social situation, who's their support, whether it's friends, family, or if they don't have any, which is actually very common. I think and so being and I would say that this is nothing new. BAYADA is 45 years old, was started in Philadelphia, and has always had this focus on meeting patients where they're at in the home. And so, in some ways, the healthcare system, I do think, is migrating toward BAYADA's point of view, in many aspects. And so, I think, if I were to say from like a larger level, very narrowly, our biggest problem is finding enough workforce, right? People to go into the homes. There's tremendous demand. We just don't have enough people. And so, that's the part one. Part two, I would say our payment models are still rooted in the 20th century, right? Around, aren't necessarily oriented around value. And then number three, we're still seeing as sort of the, that I would say the hospitals, health systems are seen at the pinnacle of the health system. And, the home care providers are, definitely still not seen as, on equal footing. From a macro perspective, right, our teams day to day are just trying to get more people in the home. But I think elevating the dialogue, the discourse around what can be done in the home is really important, right? And so, one thing is to make sure that, caregivers, potential, workforce understand how, great an opportunity it can be to work in people's homes, right? One-on-one with them. And so it's attracting talent, right, and retaining them. The second piece is, helping to make sure that talent has the tools that they need, right? We still have, EMRs and things like this that are, again, rooted in that 20th century. So looking for, technologies that can support the caregivers and the patients that they're serving in the home. And then the final thing is just like, the work that I do is really around attracting, innovators, entrepreneurs, trying to get, health, payer partners to start, experimenting on new models of care, new payment models, new technologies, right? And so when I say, we've been doing this work for a really long time. We have a lot of empathy for what the patients need and what's necessary. The question is, how do we help to move the healthcare system, to kind of, in many ways, understanding our perspective too, right? Is that kind of what you're looking for? Or or I could certainly get more tactical, which is, we're setting up a fund, right? And I'm working on a venture studio to literally help entrepreneurs build these new companies, right? And it's not, BAYADA is a very entrepreneurial organization. We'll do some of this internally, right? New services, technologies, and tools. But also, we do believe that partnering with, whether it's, large scale venture capital, entrepreneurs that are independent and outside of BAYADA, health plans, others, right? So we have to do things differently too, to make sure that we're not insulated, right? But we're engaging the rest of the healthcare system to give them perspective, on our point of view.
And I think that's an interesting perspective, and thank you for that. It can be a very difficult question. I'd like to hear from Vijay on anything that sort of CHOP is doing directly to impact this, but then maybe we'll open it up a little broader to ask really this is a fundamental systemic change. Who needs to drive that? Because again, your organization, my organization, individuals, patients, lots of people have to be involved. But how does this actually happen? So let me throw it to Vijay, ask if there's anything specific he wants to highlight that CHOP is doing, and then maybe jump off from there.
Yeah, absolutely. So, just a short story before. So I was with my previous employer for 8 years, and I don't remember a single social conversation where people didn't walk up to me and say, my bill is too high or my quality of internet is too slow. And when I joined CHOP, the conversation has been very different. Like in most cases, everybody is appreciative of the care that they got at CHOP, and that was a very refreshing perspective to hear. So the challenge, for us is, when you get care, you are very appreciative of the care that you got. So, but the challenge for us is, how do we seamlessly provide access to that care, and how do we continue that care after you leave the four walls of an hospital? So that, in a nutshell, is one problem area that CHOP is focusing on. How do we provide easy access to the care? How do we handhold you while you're waiting for your appointment? In most cases, you wait 26 days. You have an appointment, you wait 26 days for your actual appointment. How do we handhold you through those 26 days so you're not on your own? And then once you leave the four walls, how do we stay in touch with you without it being intrusive or burdensome, and still being empathetic and effective in the process? And then related to this is, we are looking for platforms and products that can seamlessly integrate in this care journey, as opposed to professional services and building one-off solutions that will not necessarily scale within CHOP or even outside the health system. And then the third focus that I would say is more around social equity of care. Of every service or every solution that we build, we want to make sure that everybody has, and as much as possible, an equal access to those feature set. We should not intentionally or unintentionally eliminate certain segments from receiving those care treatments or access to clinical content or anything that might help them with a healthy lifestyle. So those are essentially three topics that CHOP is very keen on making a progress within the next fiscal year for us and in the coming years. And one additional thing I'd pick up from a previous conversation, I think it was Dan who mentioned this. There is some similarity between the financial system as well as the healthcare system. To most part, the financial system works because we have certain entities that manage our credit history for the entire country. There's that enables home loans or mortgage loans or job applications to work, because there is a seamless access to that financial history, so certain people can make certain decisions, right? Just imagine the same, if you were to get a mortgage and you had to print all your bank statements from bank A and bank B and bank C, and then take it to your mortgage company and then get approval of the mortgage. It will be extremely ineffective and inefficient, right? But that is what we seem to have created within healthcare as a system, that we don't have access to all the necessary information to enable an ecosystem to work efficiently.
There's definitely fragmentation, and that is a big challenge. So maybe that brings us back to the question, and maybe I'll throw that out, kind of see who wants to, as a jump ball, see who wants to answer it. But who really, if we want to move towards this more patient-centered vision of health, is this something that happens incrementally? Each of us does our thing and we kind of try to move the ball a little bit further down the path, or is this something that has to be transformational? And if so, who leads that? Is that the government? We've gotten a couple of questions from the audience about that and the role of the federal government, or I guess the state government in this. Is this something that's institutionally led? And if so, is it institutionally led from the inside of healthcare? Or is this something that, and we've heard a lot of talk about the healthcare plans of some of the tech companies, Amazon with their PillPack acquisition and moving into healthcare, Walmart creating their in-store clinics, and looking to become a primary care, clinician. Is this something that comes in from the outside? I'd love to get thoughts on maybe who would lead this and how. I don't know if somebody wants to try to take that.
I will lead off, if you'd like, on that one. In my studies of what I would consider 4,000 years of history in healthcare, what you see about change is that sometimes it comes from the inside and sometimes it comes from the outside. So I mentioned already clinicians who got sick and were patients and then created changes, raised awareness and so on. But then look what ACT UP did in changing the way that we address expediting the development and approval of drugs that we need. The rare disease community did the same thing. Tom, you described this as a complex system, and the wonderful thing about complex systems is that butterfly effects work. So sometimes the smallest change can create a really positive impact, which means that although Amazon just might succeed in doing something with all the capital and logistics and reach and all of that other that they have, the reality is that the little guy can make a difference too. And I will tell you, today, aside from the home, I will nod to Adam about that. The home could well be the best healthcare setting, and it is the most common healthcare setting that we have. After all, Dr. Mom is kind of in charge of it all. After that, there is a pharmacy, last time I looked at the data, on average every square mile in the United States. Now, today, we take for granted that we can go to a pharmacy and sometimes in a grocery store while we're getting our groceries and get a shot. Now, that didn't happen automatically. We started working on that in the late 1980s. So it took a number of decades to create all of the Practice Act and financing and procedural changes and training that needed to happen. But we made that happen. And literally at the start, there were only a small handful of people who did that. So what I think we have to do is keep our eye on those people who've got Amazon's capabilities and see what they might do, and make sure that they do it in the spirit that we have talked about today, of really caring for people. And then at the same time, I think we've got to nurture some of the innovators, because it's hard to be in that space if you lack the capital. So we've got to find and nurture them, which is why I'm so happy that we've got these kinds of supports and incubators around here.
Hey, Tom,
Yes, Dan.
It's interesting when and I've spent the majority of my career outside of healthcare, not inside of healthcare. And look, we've seen this movie before, right? I've spent the last 3 decades in life sciences and education. And in both of those industries, similar to healthcare, I think that people, stakeholders in that industry, participants in those industries have almost weaponized regulations and complexity as an excuse not to innovate. And so that's one of the first things we need to get to past, is that idea of we can't do these things. And if we're not willing to challenge some of the traditional ideas and the institutionalized ways that healthcare operates, then we're not going to have that type of transformative change that we all know we need. Now, the interesting thing on healthcare is there's a clear mandate and alignment around what the future needs to be. Through all the discussions I've had, the discussion we're having today, there's not disagreement on necessarily where that journey is going towards and what that looks like. think the harder thing is the bridge to get there and the journey to get there and how that happens. You mentioned this massive transformation. In my experience as well, transformation is not this sort of big bang moment where everything all of a sudden changes either, right? You need to start, and Glena was alluding to this as well, like it starts with small things that then sort of de-risk and improve the viability for others, and that continues to grow as well, right? One of the things throughout the last year on this listening tour, people have been telling us all the time, like, what you're trying to do is really hard. How are you going to do that? Healthcare doesn't operate that way. And my answer is always the same. I said, I'm not trying to change all of healthcare overnight. So we're going to work with the early innovators and the first few that really share similar vision and willingness to change, and they'll de-risk it for the next, wave and the next wave and such and so forth. But I think, in summary, in my mind too, I think there's a different mindset that we need to all bring to the table. And I think there's a different level of true collaboration that needs to happen, right? Healthcare suffers from a if not invented here syndrome. And that to me is an impediment to where we need to go in this journey together. So if we can let down those walls and that resistance to sort of connect and lock arms, then I think we'll get a lot further faster as an industry.
Yeah, it is, because it's so complex and so interlocking, and we've actually discovered that too, is that it's very difficult for a health plan to drive innovation along a care journey, because we don't provide care. That's not our job. And so if we try to impose something on the system, you get resistance. Whereas if you can find caregivers, it could be health systems, could be whoever, who have a desire to fix or change something and then work with them to enable that change, you now have bought-in stakeholders on the provider side who are really going to drive whatever change you're looking for into the workflow. But I again, kind of jump balls a little hard, tough format in this, but other comments on that topic?
I can go next. So,
Yeah,
one thing that I want to pick up from what Dan said, I do think regulations and reimbursement model and getting like more federal and like state enablement of these two will help reduce the friction in this process. And that said, the other point I would make is the distinction of insider and outsider has been somewhat blurry of late. If Dr. Fauci can go to TikTok to talk about COVID vaccination, those things couldn't be further apart, but he had to use a less than traditional model to get past the barriers. And similarly, Amazon and Walmart, they're no longer outsiders as large employers. They have a huge stake in this chain. So, but it will take all of us. It will take more than one of us to make a dent in this whole system.
Yeah, Tom, it's Jill. I would just add to all of that, because I agree with everything everybody said. And I think kind of one other fundamental shift that I think is another, to Vijay's point, kind of a blend of inside and outside, is that we're going to have to figure out a functional way to stop kind of using HIPAA as a shield. We had created, look, I think it's actually great regulation in so many ways. And while I believe it was intended, right, to protect people's information from being exposed to others, right, I think it's morphed into protecting people from themselves in a way that's become very unproductive in the system. And to Dan and others' points about sharing information, figuring out how to pair that with an empowerment, and getting back to the fact that the P in HIPAA, some people think it stands for privacy, some people think it stands for paperwork. It actually stood for portability, right? It was supposed to be your information. And we have not figured out a way to allow someone to actually feel that sense of ownership. And it's why, to me, why we still have this, I'll call it cultural gap in healthcare, where I feel like we're trying to put the patient in the center at times. And part of the reason it fails is because people feel this kind of, apathy, right? They've kind of said, look, I don't know how to do this. I can't, I don't feel empowered. I don't feel like I have that ability to be able to engage. because I don't have the information. And I think we have to figure out a way to be able to not just, inundate them, expose their medical records, right? And I'm not saying that's not a valuable intent, right? But we can't give them an avalanche of data and be like, here, now you have it. This is going to be great. Now you have everything you need, be careful what you wished for. We really have to blend that with the understanding of human behavior, back to Adam's point about meeting people where they are. This is all about that, and really understanding how people engage with health information in a way that drives that empowerment that we seek, or we're going to end up just kind of continuing the cycle for me.
And I think that's, now there are some of the new transparency laws that are coming into effect where claims data, medical data has to be available to patients. You have to be able to download it in a standardized form. So in theory, it could be useful. And in theory, a patient is going to be able to control, I want Dr. X to see this data. I want Dr. Y to see that data. I want family member Z to see this stuff.
Right.
I think the question that you raise is a really good one. And we had a couple of questions about this from the audience too, is the role of the patient in all of this. Is the patient, because this stuff is complex, and realistically, in most healthcare journeys, the patient is they're dealing with things they don't necessarily understand, that they've never gone through before, and they're at a very, very vulnerable time. So how much responsibility sits with the patient? What is the role of the patient in this whole, in revamping this journey? Or is this something that needs to be, there's been a lot of talk about the health concierge model, or the health, a Sherpa or health guide model, somebody to guide a patient through this. What's your thoughts on the role of the patient? How much of this can the patient do?
Yeah, I'll just quickly go just to follow up on that last point, but I know a lot of others have really salient points on this as well. But yeah, for me, it is, we do have to think about enabling that support structure. That will include, I think, some combination of that health Sherpa, that concierge, that advocate, and that family, and figuring out how to create that portability model that I was talking about earlier. To me, that is really at the core of this, because when you remove that from any individual kind of ecosystem, whether it's an individual provider, a healthcare system, and you put that kind of back in the hands of the patient in the way in which they're able to ingest information that they understand, that's usable by them, where they can put also in their side of the story, right? Because so many of the tools that we've offered to folks are like, great, here's the tool, here's the portal, here's your lab results. And what we find is people download that, take a picture of it, put it in a notebook, and write their notes on it, right? Somewhere separate. And that something has to reflect their side of the story if we're going to expect them to take control, because they don't understand what the doctor put in there, right? They heard something in that session, they heard something in that visit with their doctor, and they wrote it somewhere totally separate, disconnected from the medical records, in a way in which that doesn't combine those two. And if we want, this has to be a singular journey for folks. We have to be able to meld those two and then share it with that support structure before that point of vulnerability. It needs to become part of our social construct. We don't teach any, my kids are taking financial planning classes in high school now. There's not a single element of it on health insurance, managing your healthcare. There is not anything that I can see anywhere in a high school curriculum, in a college curriculum. My kids are being taught car insurance. I was like, hey guys, how about the biggest part of your life going forward? Is a huge part of this is going to be managing your health. And we don't teach them about that. So that that empowerment of people and the understanding of that information, and then the access to that information, to me, that's the ecosystem change that really needs to happen. So,
it's a great point, Joe. The other thing, and we haven't talked a lot about COVID here, and I know we have limited time, But I want to call out the fact that, what we've been through and continue to go through now, over the last year and a half with COVID has not only exposed a lot of the cracks in the foundation of healthcare, but what we've seen in terms of different modalities of care has revealed not only what is possible with technology and virtualization, but what is preferable, right? If you rewind 2 years ago, we would hear things like elderly people can't use technology. Well, that's just flat out not true, right? Whether it's a grandparent getting on Zoom with their grandchild or navigating healthcare, like the skills are there. We need to provide the environment that is much more accessible and much more fluid so we can achieve this model where patients are more empowered to engage in their care and collaborate on their care.
I will say that, definitely I can message my doc, it would have been unheard of a few years ago, even a year ago, but, being able to message my doctor through the patient portal, through Epic, and have them answer is a huge switch from where, the system used to be. We are at just over 9:31. I think that whole concept, you're right, COVID has thrown a complete monkey wrench. It's potentially a transformational event in terms of how patients and how the healthcare system interact. We didn't get a chance to touch any of that. Unfortunately, I think we do have to wrap up because we are out of time. This was, I think, I want to first of all thank everybody. This was a really interesting panel. We had a really wide variety of comments, a wide variety of perspectives. Jill and Glena, talking a lot about that kind of patient experience and that, that social network, hearing from entrepreneurs like Dan, hearing from people inside the system, frankly, like Vijay, although he does admit that he is new to healthcare, which brings a really nice perspective, and of course, Adam, and that perspective on the home healthcare. I think we have to throw it back to Dean or somebody now, but I believe we're all, okay, we're going into the networking session, and I believe most of the panel will be available for that, and maybe we can pick up on some of these, some of these discussions and continue with them in the smaller format. So thank you, everybody. Thank you for having me on behalf of Independence Blue Cross. This was an awesome and frankly a fun panel to moderate.
Tom and all the panelists, a big thank you. Yeah, there is just such a wealth of knowledge sitting here on the screen, and some tremendous questions too from the audience. But I love the combination of both big organizations as well as startups and mid-sized organizations. We are going to continue the conversation. So in your chat right now, you'll see a link for the Remo room. Before we go, I just want to thank once again our sponsors, Independence Blue Cross, represented here by Tom, Olenzak, Anexinet, Duane Morris, Eisner-Amper, and SAP. We will continue these conversations, not just in Remo right now, but in the future. I look forward to getting back in person as well. But thank you all for your insightful comments and wisdom. And again, to everyone, go into chat right now. You'll see the link for the live Remo room. Click on that and you'll be able to continue the conversation. And again, thank you all. Have a great rest of your day.
Thank you. Take care.
Thank you, Dean.
Thanks
Bye.
all.